The monitor flatlined at 9:03 p.m. Dr. Brennan stepped back from the table, hands still gloved in blood, and said the words everyone dreads. Time of death, 2117. Then a second-year resident nobody trusted me. Did something that should have been impossible. But before I tell you that, let me tell you how that day started. You're the replacement doctor. Victor Brennan stood in the doorway of Trauma Bay 3, arms crossed, white coat spotless despite the chaos bleeding through every other corner of the hospital. His eyes moved from the tablet in his hand to me. I was adjusting my surgical mask near the supply cart. I didn't look up, because if I did, I knew what I'd see. Judgment, questioning, distrust. I'd seen it all before. Dr. Hayes, I transferred from the residency program in Portland 8 weeks ago, I said. I know who you are. Of course you did. A man who'd run this department for 15 years didn't appreciate surprises. He stepped closer, and when I reached for gloves, his eyes caught on my left wrist. The edge of my tattoo showed just below my sleeve, a medical caduceus wrapped in what looked like dots and dashes. What's that? I glanced down. Something personal. We have a dress code here, Dr. Hayes. Visible tattoos aren't part of it. I met his eyes for the first time. Green, calm, the kind of calm that unnerved people because it didn't match the usual nervousness of a second-year resident standing in front of the chief of trauma surgery. I'll keep it covered, I said. He grunted, tapped his tablet twice. You're on appendectomies today, doctor. Okonkwo will supervise. The patient in Bay 7 has been prepped. Routine case. Think you can handle that without improvising? The last word landed like a warning. Yes, sir. Good. Because I've read your file, Dr. Hayes. 2 programs in 3 years? That tells me you either can't follow protocol or you think you're smarter than the people teaching you. He leaned in slightly. Which one is it? I didn't flinch. I study hard. Studying isn't the same as experience. He turned toward the door, then paused. And that tattoo? Keep it covered. This isn't some strip mall parlor show. He left. Here's what he needed to know. I wasn't studying hard, I was just trying to forget. 7 years ago, I was Major Kira Hayes, Navy combat surgeon. I performed surgeries in tent hospitals in Afghanistan, in Syria, in places I didn't even know the names of. I saved lives with mortar fire in the background. Until one day, our medical evacuation helicopter got hit by an RPG. 3 people died, I survived, and from that day on, I've been trying not to be that person. But some skills don't fade, some training doesn't wash off. And that day, in Bay 7, during what was supposed to be a routine appendectomy, I felt those skills starting to surface. When Dr. Rachel Okonkwo made the first incision, my eyes caught something the scans hadn't shown. The appendix wasn't just inflamed, it had ruptured. The infection was spreading. The smell hit first, faint but unmistakable, the kind that doesn't belong in a routine appendectomy. Dr. Okonkwo. She didn't look up. What? We have peritonitis. The appendix ruptured before we got in here. Her hands paused, and that's when what I'd been hiding for 3 years started coming out. The skills I'd learned in war zones, the ability to recognize the smell of death before it arrived, the knowledge of how to do something that shouldn't be possible. The patient was a 17-year-old girl named Sarah Kim, basketball player, honor student. Her parents were in the waiting room, holding hands, believing this was routine. Dr. Okonkwo's face went pale as she assessed the situation. The peritoneal cavity was contaminated. What should have been a simple 30-minute procedure had just become a race against septic shock. We need to call Dr. Brennan, she said, voice tight. We don't have time. Hayes, this is beyond. I can handle this. She looked at me then, really looked at me, and something in my expression made her hesitate. Maybe it was the steadiness in my hands. Maybe it was the calm in my voice. Maybe it was something else entirely. What do you need? She asked quietly. Suction, more irrigation, and trust me for the next 20 minutes. My hands moved with the precision I'd spent 3 years trying to suppress. I'd learned to operate in conditions that would make most surgeons freeze and tense with generators failing, in helicopters banking hard to avoid ground fire, in darkness with only headlamps for light. A ruptured appendix in a fully equipped AR was nothing. I cleaned the peritoneal cavity methodically, removed the appendix, checked every millimeter for additional contamination. Dr. Okonkwo assisted without question, matching my rhythm, anticipating my needs. 23 minutes later, Sarah Kim was stable. The infection was contained. The surgery was a success. Dr. Okonkwo pulled off her gloves slowly, eyes never leaving my face. Where did you learn to work like that? Portland. I lied. No, nobody learns that kind of speed and precision in a civilian residency program. She stepped closer, lowering her voice. I've seen combat surgeons work case. My brother was Army. You move like them. I didn't answer. I won't say anything, she continued. But whatever you're running from, maybe it's time to stop because what you just did saved that girl's life. She left me alone in the OR, and I stood there staring at my hands. These hands that had held together soldiers' insides while explosions shook the ground, these hands that had tried so hard to be ordinary, the next 2 weeks were carefully constructed normalcy. I kept my head down, followed protocols exactly, volunteered for the worst shifts. I became invisible again, just another resident grinding through the endless hours. But Dr. Okonkwo's words stayed with me. The tattoo on my wrist, Morse code for steady hand, steady heart, felt like it was burning under my sleeve. It was something my team had gotten together after a particularly brutal week in Kandahar, a reminder that even when everything around us was chaos, we could be the calm center. I'd covered it for 3 years, hidden it like I'd hidden everything else from that life. At night, I'd lie in my apartment and replay the helicopter crash. The screaming of the engines, the way the world tilted sideways, the smell of burning fuel, the silence after, broken only by someone crying. I'd survived. Corporal Martinez hadn't. Neither had Lieutenant Chen, or the pilot, Captain Brooks, who'd fought the controls until the very end. I'd walked away with a concussion and 3 cracked ribs. They'd gone home in flag-draped coffins. The Navy gave me a medal. I gave them my resignation. And for 3 years, I'd been trying to be someone else. Someone who didn't hear the sound of artillery in every slamming door. Someone who didn't flinch when helicopters flew overhead. Someone who could forget. But you can't forget. You can only pretend. I need a REBOA kit. If we don't have one, I need a 7 French sheet, a wire guide, and a compliant balloon catheter. Ultrasound for femoral access. Fluoroscopy if we have it. But I can do this blind if necessary. The nurses scattered. Brennan moved to the head of the table. Marcus, continue compressions until I tell you to stop. Rachel, I need you on ultrasound. My voice had changed. It wasn't the voice of a second-year resident asking permission. It was the voice of someone who had commanded operating rooms in war zones. Clear, certain, unshakable. Rachel positioned the ultrasound probe over Daniel's right groin. The screen showed the femoral artery, pulseless but visible. Good access, I said. Prep the site. My hands worked while Marcus continued compressions. Betadine. Drape. The familiar ritual of creating a sterile field while someone's life hung in the balance. A nurse returned with supplies. Not a pre-made REBOA kit. We didn't have those in civilian hospitals yet, but the components I needed. Stop compressions, I said. The room went quiet except for the monitors. I felt for the femoral pulse that wasn't there, using anatomical landmarks instead. My fingers found the spot by memory, by training, by something deeper than conscious thought. The needle went in smooth. Dark blood flashed back. Wire. Rachel handed it to me. I threaded it up through the artery, watching the ultrasound screen, counting centimeters in my head. The wire disappeared into Daniel's body, following the path of the iliac artery toward the aorta. Sheath. The sheath went over the wire, seated into the artery. I removed the wire, placed the balloon catheter. How far? Brennan asked, watching over my shoulder. I needed at the diaphragm level, just above the celiac trunk. I looked at Marcus. How tall is he? About 6 feet. I did the calculation. 45 centimeters from the insertion site, I threaded the catheter up, counting the depth markings using the anatomical knowledge burned into my brain from years of doing this in impossible conditions. At 45 centimeters, I stopped, inflating. I attached the syringe to the balloon port, drew back, pushed forward. 8 milliliters of saline. The balloon expanded somewhere inside Daniel's aorta, pressing against the walls, occluding blood flow above the hemorrhage. Resume compressions. Marcus started again, and this time, the monitor flickered. A blip, small, irregular. But there, I've got something, Rachel said, staring at the screen. Another blip. Then another. The electrical activity was disorganized, but it was there. Charged to 200, Brennan said, his voice tight with controlled excitement. The defibrillator whined, clear. Daniel's body arched. The monitor showed 3 strong beats, then fell back to irregular rhythm. Again, clear. This time the rhythm held, weak but steady, a sinus rhythm struggling to establish itself. I've got a pulse, Rachel said, fingers on Daniel's carotid. Faint, but it's there. The room erupted in controlled chaos. Orders flying, medications being pushed, the crash cart being rolled back. But through it all, I stayed focused on the balloon catheter in my hand. We have maybe 10 minutes before ischemia to his lower body becomes irreversible, I said. We need to get him to OR now. Brennan was already on the phone. R2, immediate. Get vascular on standby. We have an iliac artery repair. The transport team arrived within minutes. We moved as a unit, me holding the catheter steady, Rachel managing the airway, Marcus squeezing the IV bags, Brennan coordinating everything. In the elevator going up to the OR, Brennan looked at me. That was the most controlled battlefield procedure I've ever seen in a civilian hospital. It's the same everywhere, I said. Life or death doesn't change because of the location. No, he agreed. But the people who can operate under that pressure do. Dr. Sandra Lim, the vascular surgeon, was already scrubbing when we arrived. She took one look at the setup and nodded. Military background? Navy? Good, I was Army. Let's save this kid. The surgery took 90 minutes. Dr. Lim repaired the severed iliac artery while I managed the REBOA catheter, slowly deflating it as blood flow was restored through the surgical repair. It was a delicate balance. Deflate too fast and the hemorrhage could restart, too slow and the ischemic damage to his legs would be permanent. But my hands remembered. They'd done this before in worse conditions with fewer resources. At 10:47 p.m., Dr. Lim placed the final suture. Arterial flow is good. Lower extremity perfusion looks excellent. She looked at me over her mask. He's going to make it. I deflated the balloon completely, withdrew the catheter, applied pressure to the femoral access site. Daniel Foster's monitor showed strong, steady vital signs. His body was fighting back now, recovering, healing. He was going to live. I was in the locker room, changing out of my blood-stained scrubs, when Dr. Brennan found me. Dr. Hayes. I turned. He stood in the doorway, still in his surgical cap, face unreadable. Yes, sir. I spoke with Dr. Lim. She said that was some of the finest trauma management she's seen in 20 years of practice. I didn't respond. I also pulled your complete file, not just the residency transfer paperwork, the whole thing. He stepped into the room. Major Kira Hayes, Navy Cross recipient, 11 combat deployments, 68 documented saves under fire, medical evacuation helicopter crash in Syria, 2021, honorable discharge, 2022. The air felt thin. Why didn't you tell anyone? He asked. Because I didn't want to be that person anymore. Why not? That person saves lives. That person watched 3 friends die because she couldn't save them. The words hung between us, raw and honest. Brennan was quiet for a long moment. Then he said, I lost my first patient when I was a resident. 22-year-old kid, motorcycle accident. I did everything right. He died anyway. He met my eyes. I spent 6 months thinking about quitting, wondering if I was good enough, if I could handle the weight of it. What changed? I realized that the ones I couldn't save didn't mean the ones I could save mattered less. If anything, they mattered more. He pulled something from his pocket, a small card. This is Dr. Sandra Lim's direct number. She wants to talk to you about a position. I'm a resident. Not for long, if she has her way. She's proposing you as a trauma fellow with a focus on developing combat casualty care protocols for civilian settings. It's a new program. You'll be designing it from scratch. I stared at the card. Dr. Hayes, what you did tonight was extraordinary. But more than that, it was necessary. There are procedures, techniques, ways of thinking from military medicine that could save lives here, and you're the bridge between those worlds. He placed the card in my hand. Stop running from who you are, start using it. He left. I stood there looking at the card, feeling the weight of 3 years of hiding lift slightly. The Pentagon conference room was smaller than I expected. 20 people around a polished table, half in uniform, half in civilian clothes. I stood at the front with the presentation remote in my hand and a PowerPoint behind me that read, Combat to Civilian, Integrating Battlefield Trauma Protocols into Emergency Medicine. I'd spent 6 months developing this, working with Dr. Lim, with Dr. Brennan, with military advisors and civilian trauma directors, creating a bridge between two worlds that spoke different languages but shared the same goal, saving lives. The average time from injury to definitive care in a combat zone is 45 minutes, I said, clicking to the next slide. In civilian trauma centers, it's 22 minutes, but civilian centers face different challenges, multiple simultaneous casualties, limited resources, protocols designed for peacetime medicine. I walked them through the curriculum, REBOA training, damage control surgery, hemorrhage control techniques developed under fire, mental health integration for providers dealing with traumatic stress. When I finished, the room was silent. Then a colonel in the back row stood up and started clapping. One by one, others joined. After the presentation, people lined up to shake my hand, exchange cards, ask questions. A VA administrator wanted to discuss implementation. A trauma surgeon from Johns Hopkins wanted to collaborate on research. But the person who meant the most was waiting at the back of the room. Jay Voloff, the paramedic from Trauma Bay 3, now in dress blues with a chest full of ribbons. Major Hayes, he said, saluting. I returned it, smiling. Just Dr. Hayes now, Jay. Not to me, he grinned. You're the same person who pulled my lieutenant back from the agency area. The same person who wouldn't give up on that construction worker. Rank doesn't change who you are. No, I agreed, but accepting who you are can change everything. I still have nightmares about the helicopter. I still hear the sound of the engines failing. Still smell the burning fuel. I don't think that will ever completely go away. But I've stopped trying to run from it. Instead, I use it. Every life I save, every resident I train, every protocol I develop, is a way of honoring Martinez, Chen, and Brooks. It's a way of making their deaths mean something. Daniel Foster recovered fully. He walked his daughters to their first day of kindergarten. He came back to the hospital to thank me. And when he did, I realized something. I wasn't saving him to make up for the ones I lost. I was saving him because that's who I am. Dr. Liam made me director of St. Catherine's new trauma innovation program. I'm designing protocols, training residents, consulting with hospitals across the country. I'm not hiding my tattoo anymore. I wear short sleeves, and when people ask about it, I tell them the truth. Steady hands, steady heart. That's what my team believed. That's what I believe now. Because when the monitor flatlined, when everyone else stopped, I didn't. And that made all the difference. This is my story. The story of learning to accept who I am, to face my past, and finally, not just to save lives, but to save myself, to be that person again.